All right, picture this. You're in a hospital bed, maybe a little nervous,
Mm.
right? And you see nurses all around doing their thing.
Mm.
Ever stop to wonder, how do they even figure out how many nurses should be working? Like, why is it sometimes one nurse just for you, and other times it's a whole team, each with their own tasks?
Yeah, it's a good question. Doesn't always seem obvious.
Right. So today, we're going deep on nursing care delivery models, how hospitals organize all that care, how it impacts you as a patient, the whole deal.
Definitely impacts the patient experience. Big time. We often forget nurses aren't just individuals. It's how they work together that makes a difference.
Exactly. So first things first, what do we even mean by patient care when it comes to nursing?
Well, the heart of it is preventing, treating, managing illness. But it's not just the physical stuff. It's the patient's whole well-being, mental, emotional. That's where nurses and all those allied health folks, they really shine.
Makes sense. So how do hospitals figure out the best way to organize all that? Seems like a huge job, right?
Oh, it's massive. Starts with knowing your patients, their needs, and what your staff can do, their skill levels. Hospital leaders got to be on top of that. And one tool they use? Patient classification systems. PCS for short.
BCS, okay. Sounds kind of technical. What's that in plain English?
Basically, it's a way to measure how much care each patient needs, like literally quantify it. That helps figure out staffing, not just in hospitals, but nursing homes too. How many nurses on each unit, what skills they need, the whole shebang.
So not just randomly assigning nurses, there's actual calculations going on.
You got it. And it takes a whole team to get this right, not just one person. Selecting and using a PCS involves a whole committee. Nurse managers, administrators, folks from all over the hospital.
Teamwork. Got to make sure the system actually fits the hospital's needs.
Exactly. And it's got to be adaptable because patient care, always changing.
So true. Healthcare is never static. What makes for a good PCS then? Besides being adaptable, I mean.
Well, first, it has to tell the difference between patients. How much care they need, is it a little or a lot? Not everyone's the same.
Like a triage, but for ongoing care, not just the ER.
Right. Got to match the right resources to each patient. That's the second thing, resource matching. Figuring out how much time, effort each nursing activity takes.
So it's matching nursing skills to patient needs, like a dating app, but for healthcare.
Uh-huh, exactly. And like any good system, got to be practical, right? A good PCS is economical, easy to use, doesn't cost a fortune, can't be bogging down the staff with paperwork.
Efficiency is key,
Mm.
especially in a hospital. What else?
Clarity. Everyone needs to understand it, from the nurses doing the work to the folks managing the money. If it's confusing, it won't work.
Makes sense. So we figured out how much care each patient needs. What happens next?
Staffing decisions, budgets, that's where this all leads. PCS helps figure out how many nurses, what types of nurses you need. It's all based on time.
So not just the number, but making sure their skills match the patients they're caring for.
Right. Experience level matters too. Some patients need more specialized care, and this all feeds into the budget, helps with costing and planning.
Wow, so it's a budgeting tool, staffing guide, and it ensures patients are getting what they need.
Exactly. It also helps managers track if patient needs change, over time. If a unit suddenly gets a lot of really sick patients, they can use this PCS data to say, hey, we need more staff.
So it's real-time data for smarter decisions. Awesome. What happens if a hospital just doesn't have the staff to meet what the PCS says?
That's tough and sadly pretty common. Sometimes nurse managers got to make hard calls, might even staff below what's ideal to save money.
Sounds stressful. Makes you realize how important funding and support for healthcare is.
It is. And before we get into specific nursing care models, got to give a shout out to London Heartbeat Z Academy in the UK. They helped us big time with this deep dive.
Yes, huge thanks to them. Their resources are fantastic. Over 140 courses on all sorts of healthcare topics.
And super active on social media, Facebook, Instagram, Spotify, YouTube, the whole 9 yards. Check them out for updates, discussions, all that good stuff.
Definitely worth a follow. Now back to it. We've talked about figuring out how much care is needed, but how's it actually delivered? That's where these nursing care models come in.
Right on. And first up, we've got the OG model, the oldest one, the case method, sometimes called total patient care.
Case method. Sounds pretty straightforward. What's the gist?
Basically, it's one nurse taking care of all the needs of their assigned patients, the whole shift. Your very own personal nurse for the day, you could say.
Wow, that's amazing. From a patient's point of view, I mean, you get all that attention, personalized care.
That's it. It's how a lot of nursing students are first taught, focus on one patient, learn everything, still used today, especially where that one-on-one is super important.
Like, I'm thinking intensive care, labor and delivery, places where you need constant attention.
Exactly. Having that one nurse focused on you can be life-saving in those settings. They get to know you, can spot problems early, react fast if something goes wrong.
Really maximizes that expertise and connection for the patient's benefit. What other advantages does it have?
Biggest one is that personalized care. The nurse has the time, they're right there, to get to know you deeply. Not just your chart, but you as a person. Builds trust, makes you feel safe.
Like having a healthcare advocate, someone in your corner who knows what you need.
That's a great way to put it. That nurse becomes a familiar face, someone you can rely on during a tough time.
But I'm guessing there are some downsides too, right? Sounds great in theory, but real world's a different beast.
You're right, not without challenges. Biggest one is cost. One nurse per patient gets expensive, got to pay for all those shifts. Not every hospital can swing that.
Makes sense. Big investment in staff, which we know is already in short supply.
For sure. Even if you can afford it, finding enough nurses who can do all those things, that's tough. It's demanding, physically, emotionally, to have that much responsibility.
Right. You need the right skills and the emotional resilience. What if the nurse gets overwhelmed, has too many really sick patients?
That's a risk. Even the best nurse has limits. So yeah, case method, great in theory, but not always practical or the best use of resources.
Right. It's all about finding the right model for the situation. So let's move on. We've got functional nursing next, which seems to be a totally different approach.
This one's all about efficiency, dividing up the work so nurses specialize. Instead of one nurse doing it all, you've got your medication nurse, your treatment nurse, and so on.
Like an assembly line, but for healthcare.
Haha, great analogy. And just like an assembly line, it can be super efficient. Nurses get really good at their specific tasks, things move faster, fewer mistakes.
And I bet, cost-wise, that specialization is appealing.
Absolutely. Financially, it makes sense because you're using different skill levels to get the job done. A highly trained RN handles the complex stuff, while, say, a nursing assistant can help with basic care.
So you're getting the most out of your staff, playing to their strengths,
Yeah.
streamlining everything.
Right. And since they focus on one thing, they get really good at it, which can be good for patients, too, in those specific areas.
Okay, I'm seeing the appeal, especially when budgets are tight. But are there trade-offs? Does that hyper-focus on tasks ever backfire?
Good question. And yeah, while it's efficient, you do lose some of that personal touch we talked about with the case method. You might see lots of different nurses, each doing their own thing.
So it can feel fragmented, like you're not a whole person, just a bunch of tasks to check off.
That's a real concern. Harder to build that rapport with your nurse, feel like there's one person looking out for you. Continuity of care can be a problem too. Different nurses, different ways of doing things.
Makes communication even more important in this model.
Huge. Good documentation, clear handoffs between shifts, regular team meetings. Got to make sure everyone's on the same page.
Makes sense. What else could go wrong with this model?
Well, nurses can get bored doing the same thing over and over. Not very motivating, you know?
True. You need variety in any job. Got to feel challenged.
And if you're not doing different things, it's hard to learn and grow professionally.
So maybe great for efficiency, but not for job satisfaction or keeping nurses engaged.
You got it. And then there's accountability. So many people involved, sometimes it's unclear who's responsible if something goes wrong.
Right. Clear responsibility is essential when it comes to patient safety.
Absolutely. So functional nursing, like all these models, pros and cons, works in some situations, especially when efficiency is key, but not a perfect system.
No magic bullet. Got to weigh those pros and cons. All right, what's next on our care delivery tour?
Let's talk team nursing. This one tries to take the good stuff from functional nursing, that efficiency, but address some of the downsides.
Team nursing, I like the sound of that. Collaboration, everyone working together. How's it different?
It's all about the teamwork. A group of nurses led by a really experienced RN, the team leader, they work together to care for a group of patients. Everyone pitches in, uses their strengths to make it holistic and efficient.
So not one hero nurse, but a whole team tackling multiple patients. How many people are we talking per team?
Usually 4 to 6, RNs, LPNs, maybe nursing assistants. The charge nurse, who's in charge of the whole unit, they delegate to the team leader who coordinates everything. And together, they might be caring for 15, even 25 patients.
Wow, that's a lot of patients. Sounds like a well-oiled machine. What are the upsides to this team approach?
Well, patients tend to be happier. They feel well taken care of because there's this whole team focused on them, not just one person.
It's that shared attention, that feeling that everyone's got your back. What about for the nurses on these teams?
Better communication, for one. Everyone's talking, sharing resources, plus they learn from each other. New nurses get mentored by the experienced ones.
Nice. Creates a supportive environment.
Exactly. And because they're sharing the workload, less burnout, less stress.
Crucial in a hospital, that can be so intense. So lots of benefits for patients and nurses.
Uh-huh.
But I'm sure there are challenges, right?
Of course. Big one is staffing. If people are constantly coming and going, hard to build a solid team. Team nursing needs consistency, that camaraderie to really work.
Building that team takes time.
You got it. And even with a good team, got to make sure everyone's putting the patient first. If someone's not on board with that, can cause friction.
Like with any team, you need shared goals, everyone pulling in the same direction.
And in healthcare, that shared goal is the patient's well-being.
What about responsibility? Does the team approach ever lead to, no one feeling accountable, like it's not my job kind of thing?
That's a valid concern. Compared to case method, where one nurse is clearly in charge, here, yeah, maybe a bit less individual independence for some tasks.
Yeah.
Got to be super clear about roles and expectations from the start.
Finding that balance, teamwork, and knowing who's accountable.
Exactly. Oh, and of course, money matters. Team nursing can be more expensive because you need more staff overall to cover the same number of patients.
Always that balance, teamwork, efficiency, and cost. So much to consider. This has been super interesting. What's our next stop?
Next up is modular nursing. Think of it as team nursing, but with a geographic twist.
Modular nursing, okay. Like a good twist. Lay it on me.
Picture this. You divide the unit into little zones, modules. Each gets its own team of caregivers. These modules are usually close together, so easy to communicate.
Like mini neighborhoods within the bigger unit.
Perfect. Lots of advantages to this. First, since everyone's close by, communication's a breeze. No more running all over. You can just talk face to face.
Less chaos, more teamwork. When you're working side by side, you build those relationships.
Totally. It creates a sense of belonging, a shared purpose. Good for the staff, good for patients too.
Sounds like a win-win. What else stands out about modular nursing?
Workload is more balanced, less burnout. Everyone shares the responsibilities, more supportive environment.
And a supportive team equals happier, more engaged nurses.
Exactly. And it's good for developing leadership skills. Since they're making decisions together, encourages people to step up, take initiative.
So it's not just about patient care, it's about helping nurses grow too. What about the patient experience in all this?
Continuity of care is a big one. You see the same team throughout your stay. Builds trust, less anxiety, you know who to talk to.
Makes a huge difference when you're in a vulnerable position.
Right. And everyone knows your situation, so care planning is more collaborative. Everyone on the team can contribute, create a plan that's really tailored to you.
So it's a true team effort, not just one or two people making all the decisions.
Exactly. Holistic, everyone working together can lead to better results, fewer complications, and a better experience all around.
I'm liking modular nursing more and more. But as we've learned, there's always a but.
Yeah.
What are the drawbacks?
One word, cost. Getting each module set up with supplies, equipment that can add up fast, especially if you've got a lot of them on a unit.
Like setting up multiple mini hospitals within the hospital?
Pretty much. And it's not just the initial cost, got to keep those supplies stocked, equipment maintained.
Lots of upfront planning and organization involved.
Definitely. Takes time to build those teams, get everyone on board with the concept.
And just like with team nursing, if you've got a lot of turnover, that makes things tough.
For sure. Disrupts the whole dynamic. That shared responsibility. Consistency is key. Any other downsides we should mention? Similar to team nursing, maybe a little less individual responsibility compared to other models. Focus is on the team, so individual nurses might have less control over some decisions.
Might be tough for nurses who are used to doing their own thing.
It's an adjustment. Got to be willing to embrace that teamwork aspect.
And of course, everyone needs to be focused on the patient. That should be the driving force behind every decision.
Absolutely. Patients' well-being comes first.
And
the team leader's really important here. They set the tone, make sure everyone's working well together.
so needs to be a strong leader with the right skills to manage all that.
Yep. Communication, delegation, knowing how to handle conflict, thinking on their feet. They also got to really understand the patients, what their needs are.
Sounds like a tough but important job.
Definitely. A good team leader can make a huge difference for both staff and patients.
Well, this has been a great look at modular nursing. Seems like it combines a lot of the best aspects from other models with a focus on efficiency and patient care.
I agree. Shows how thinking outside the box can lead to better outcomes for everyone.
Okay, ready for our next adventure. What else is on our nursing care delivery tour?
Now we're shifting gears a bit. Let's talk progressive patient care. This one's all about tailoring the care to the patient's needs throughout their whole recovery.
Progressive patient care. Sounds intriguing, like it adjusts to the patient as they get better or worse. How does that work?
The idea is to provide different levels of care based on how the patient's doing, how they're progressing. The goal is to use resources wisely, whether it's the facilities, the services, or the staff, to get you the best care at each step.
So not one size fits all, but constantly evaluating and adjusting as the patient's needs change.
Exactly. When you're admitted, they figure out what level of care you need right then. As you recover, you might move to different units or different levels within the same unit. The care gets less intense as you get better.
Like a step-down process, getting the right level of support and monitoring as you improve.
You got it. Lots of flexibility. The care plan changes along with you.
Okay, walk me through these different levels. What are the main categories?
Let's start with the most intense one, intensive care or critical care. This is where the sickest patients go. The ones who need constant monitoring, maybe life-saving interventions, lots of technology, highly trained nurses, the whole shebang.
The front lines, where every second counts.
Exactly. 204/7 monitoring, ready to act if things go south. Nurses here have only a few patients each, so they can really focus.
Intense. What about the next step down?
That's intermediate care. Still need close monitoring, some interventions, but not as intense as intensive care. Maybe recovering from surgery or a serious illness, getting stabilized.
On the mend, but still needing that extra support.
Right, and if things keep improving, might move down to self-care.
Self-care, so the focus shifts from the medical stuff to giving the patient tools to manage their own health.
That's it. You're actively participating in your recovery, learning about your condition, taking charge.
Love that. Empowering patients to thrive even after they leave the hospital.
It's key. You might learn about your meds, how to live a healthier life, exercise, all sorts of things to prevent problems down the road.
Give me some examples. What would patients be learning about?
Depends on the person, of course, but could be anything from how to take your meds correctly to making healthy food choices, managing stress, recognizing warning signs if things are going downhill, finding support groups in the community, you name it.
Wow, a whole toolbox of skills.
Right. It's about understanding your own health so you can take control.
And a lot of times, rehab starts while you're still in the hospital,
Sure.
getting you ready for life outside.
Exactly. Smooths that transition, sets you up for success long term.
This progressive patient care, it really seems to consider the whole picture. But moving between units, doesn't that get disruptive for patients?
That's one downside, yeah. Some people find it unsettling to pack up, change rooms, especially once they've settled in.
I can imagine, especially if you're not feeling great to begin with. What other challenges does this model have?
Keeping that continuity of care can be tough. When you move, everyone's got to be in the loop, know your history, what the plan is.
That handoff of information has got to be smooth.
Crucial. Lots of coordination, clear documentation, everyone talking to each other. Doesn't always happen perfectly, especially when it's busy.
Right. And it's hard to build those relationships with nurses if you're constantly switching, right?
That human connection can really suffer. It's about feeling understood, cared for, and that's hard when you're dealing with a new face every day.
Right. Finding that balance, being flexible, and providing that personal touch. Anything else we haven't covered?
Progressive patient care needs a lot of documentation, care planning, takes up staff time, not always efficient.
Lots of paperwork, I bet.
You know it. And sometimes hospitals struggle to keep up with all the admin stuff, evaluations, meeting standards. This model's pretty complex to manage.
Got to be organized, detail-oriented, everyone on the ball.
You got it.
Primary nursing. This one brings back that dedicated nurse idea, like with the case method.
You're right. Here, one nurse is responsible for your entire care from the moment you're admitted till you go home.
Okay, primary nursing. Sounds intense. So does that mean you have a primary care physician?
Not quite. It's a primary nurse who takes the lead. They're your main point of contact, the one who coordinates everything, makes sure your needs are met.
So one nurse for all my needs. What if they're off duty or something?
That's where associate nurses come in. They step in, follow the plan created by your primary nurse, so you always have someone looking after you.
Makes sense. Keeps things consistent. Are there certain places where this model works best?
You, You see it a lot in long-term care, like rehab, nursing clinics, anything where you need that strong, trusting relationship, especially for chronic conditions, long hospital stays.
Makes sense. That consistency's got to be comforting when you're going through something tough. Gives you a sense of, like, stability.
Totally. And it's not just the emotional support. The primary nurse, since they're with you the whole time, they really get to know what you need, what your goals are.
So they can be a better advocate for you, make sure you're heard.
Exactly. They're in your corner, working with the doctors, other staff, even your family, to make sure everyone's on the same page. The care plan is truly for you.
That's powerful. What else is good about primary nursing?
It's that holistic care. Again, the nurse is taking care of the whole person, physical, emotional, social, even spiritual. It's not just fixing the body. It's about supporting you.
Treating the patient as a person, not a case file.
Right. Healing on all levels, that's the goal. What do you think from the patient's side? How do they usually feel about this model?
I'd guess they'd feel more connected, more trusting of their nurse.
Spot on. Patients and their families, they often get really close to their primary nurse. That can be huge, especially when you're stressed out in the hospital. Less anxiety, better communication.
That human element. Can't underestimate that in healthcare. What about for the nurses doing this? Does it affect how they feel about their job?
It can be empowering. Gives them more responsibility, authority. They're in charge of their patient's care from start to finish.
Sounds like it'd be more fulfilling knowing you're really making a difference.
Definitely. And the care itself tends to be more comprehensive, personalized. The nurse can use their skills, be creative, really tailor the plan to that patient.
Okay, I'm sold on the good stuff.
Yeah.
But gotta ask, what are the downsides? Implementing this must be tricky.
It is. And just like with that case method, the biggest hurdle, cost. Need more nurses overall to do this, so it gets pricey.
Personalized care usually does. And hospital budgets are already stretched thin as it is.
Yep, reality bites. Always that balance between giving great care and staying afloat financially. What other problems can crop up?
I'm thinking it relies a lot on the individual nurse, right? Some are better than others, more experienced, more dedicated.
That's true. Even the best nurse can have an off day. Highlights the importance of training and making sure everyone's up to speed no matter what model you're using.
And someone's got to be checking their work, making sure standards are met.
Quality control, always important. What else could go wrong with primary nursing?
Well, if you've got different nurses covering sometimes, could that cause conflict? Like disagreeing over the care plan or something?
It can. Primary nurse and the associate nurses, they might not see eye to eye. Gotta have good communication, respect each other, and remember, it's about the patient, not their egos.
Like any team, got to work together, know your roles.
Exactly. Primary nurse has to be good at communicating, delegating, smoothing things over if there's tension.
Anything else to watch out for with this model?
It's a lot of pressure on that primary nurse. They're responsible 24/7, even when they're not at the hospital.
Wow, that's a heavy load.
Yeah.
You'd need to be really dedicated to handle that.
It's not for everyone, that's for sure. And finding enough nurses willing to do it, that's tough too, especially with the nursing shortage we've got going on.
Another challenge on top of everything else. Are there other limitations? Maybe things people don't think about right away.
Well, some say it can be limiting for the nurses. They're focused on their own patients, so maybe they don't get to experience other areas of nursing or collaborate as much with other specialists.
So good for going deep with those patients, but maybe not so good for broadening the nurse's own horizons.
That's a good way to put it. And while it's great for certain units, like the ICU, where patients need that one-on-one, it might not make sense everywhere. Could be too expensive or just not the best fit.
So, like all the others, primary nursing has its place. Depends on the hospital, the patients, the resources.
Exactly. Got to find the right model for the situation.
What's next on our list?
Let's talk case management. This one takes a wider view. It's about the whole patient journey, from diagnosis to recovery, even after they've left the hospital.
Case management, okay.
Yeah.
Sounds organized, like long-term planning. What's the main idea here?
You've got a case manager, could be a nurse or a social worker with special training. They're with you from the start, guiding you through the system, coordinating your care, connecting you with resources.
Like a healthcare Sherpa, making sure you don't get lost in the system.
That's a great way to put it. They're there for you, your family, and the whole healthcare team.
That's got to be helpful, especially if you've got a complicated condition where you just don't know where to turn for help.
Absolutely. Imagine you're diagnosed with cancer. Scary, right? Case manager helps you figure out treatment options, sets up appointments with specialists, explains all the medical mumbo-jumbo, finds support groups or financial aid. They're with you every step of the way.
Wow. Takes a huge weight off your shoulders, lets you focus on getting better.
Exactly. And it's not just about being supportive, it's making sure you're getting the right care.
So they work closely with the medical team, make sure everyone's on the same page.
Absolutely. Part of the team, collaborating with doctors, nurses, therapists, everyone, making sure things are coordinated, everyone's working towards the same goals.
Bridging the gaps between all those different specialists, keeping things running smoothly.
Exactly. They're the glue that holds it all together, makes the whole experience less stressful, less confusing for the patient.
I'm starting to see the value of this, especially as healthcare gets more complex, more specialized.
It's definitely gaining popularity. Healthcare systems are realizing, gotta be more coordinated, gotta put the patient at the center.
So how do they actually do this? What tools and strategies do case managers use?
One big one is something called critical paths or care maps. It's basically a plan, outlines what usually happens for a specific condition, like what to expect during treatment, recovery.
A roadmap for your healthcare journey.
Exactly. Everyone knows what the goals are, potential problems to watch out for, helps the case manager keep things on track.
So they're actively involved, not just watching from the sidelines. What if things don't go according to plan?
That's where variation analysis comes in. Big word, but it just means figuring out why things are off track. Patient's not recovering as expected. Case manager digs in, looks for barriers, complications, anything that's throwing a wrench in the works.
Like a healthcare detective.
Haha, exactly. Gathering info, talking to the team, figuring out solutions.
Very proactive. What other things are part of their job?
Communication, communication, communication. They make sure everyone's in the loop between shifts, with the whole team, lots of meetings, lots of phone calls.
Keeping everything moving, making sure no one's left out.
Yep. And they're also big on quality assurance, checking that the care is up to snuff, meets all the standards, always looking for ways to improve things.
Sounds like a demanding job, but really important. What are the benefits for the patient?
Well, the biggest one is that coordinated care we talked about. Things run smoother, less confusion, less waiting around. Makes a big difference when you're not feeling well.
When everyone's working together, things just flow better. I bet that translates to better outcomes, right?
It can. Shorter hospital stays, fewer readmissions, and might even save money in the long run.
So it's good for everyone, patients, and the healthcare system as a whole.
Exactly. Case management is about finding that sweet spot. Quality care, efficiency, and keeping costs down.
What about resources? Does this model help there?
It can. The case manager, since they're coordinating everything, helps prevent wasted effort, duplicated services, make sure the patient's getting the right care in the right place at the right time.
Like an air traffic controller, making sure all the planes land safely.
Haha, good one. And it's especially helpful for complex cases where you've got lots of specialists involved.
Makes sense. Having one person to navigate all that would be a lifesaver.
Right. Takes the guesswork out, make sure all your needs are met.
I'm loving case management. Sounds like a great system, but gotta ask, what are the downsides?
There are a few, of course. Nurses sometimes struggle to get this going. Money's a big one. Need the hospital to invest in it.
Right. Take support from the top, not just the nurses on the ground.
Absolutely. And even with support, finding the right nurses to be case managers, that's tough. It's a special skill set.
I can imagine. Sounds like you need a lot of expertise, the right personality for it.
You need someone who's a good advocate, who can think on their feet, who's comfortable making decisions.
Wow, like a super nurse.
Pretty much. It's challenging, but can be really rewarding for the right person.
This has been so eye-opening. All these different ways to structure care, who knew?
Right. And there's one more thing we need to talk about. What influences how many nurses are needed in the first place?
Ooh, good question. Feels like there'd be a lot of factors involved.
There are. Not a simple answer. Lots of things to juggle. Got to meet those patient needs and manage resources responsibly. Where do we even start?
Let's start with the obvious. How many patients are there?
That's the big one. Patient volume. More patients, more nurses. Simple as that.
Makes sense. But it can't just be about how many beds are full, right?
Of course not. How sick are those patients? That matters too. Sicker patients need more intensive care, which means more nurses per patient.
So if you've got a lot of folks on ventilators or fresh out of surgery, that bumps up the staffing needs.
Exactly. Got to consider how much care each patient needs. That's called acuity level. And not just how many nurses, but what kind of skills they have. Do you need mostly RNs, or can some tasks be done by LPNs, nursing assistants? It's a puzzle.
Trying to get all the right pieces in place.
And that puzzle's always changing as patients come and go, get better or worse.
What else do they have to consider when making these decisions?
What kind of unit is it? Different specialties, different needs?
Right, like a hard ICU is going to be different from a general floor.
For sure. And some places, like the ER, things change so fast. Hard to predict how many patients, how sick they'll be. Tough to staff for that.
Got to be flexible, able to adapt on the fly.
You got it. And then there's the individual patient needs. One person might need help with meds all the time. Another needs help getting around. Another has a complicated wound. It's a lot to keep track of.
So many details. You're right, it's not just about the overall number of patients, it's about what each person needs and making sure the nurses have the skills to handle it.
Exactly. So complex. No easy answers.
And we've talked about all these different care models.
Yeah,
Do those affect staffing too?
big time. Each model has its own implications. Like if you're doing case method, one nurse per patient, that obviously needs more staff than, say, team nursing where they're sharing the work.
Right, your choice of model has consequences down the line.
For sure. And not just the number of nurses, but their experience. Some models, like primary nursing, need a lot of RNs. Others can use more LPNs, nursing assistants.
So many factors.
Yeah.
What about the folks who aren't nurses but help out, like nursing assistants? How does that affect how many RNs you need?
Huge impact. The more support staff you have, the more they can take off the nurses' plates. Frees up the RNs to focus on the really specialized stuff.
Using everyone's skills to the fullest. Teamwork.
Right. But gotta be careful, you know? Make sure those support staff are well-trained, that someone's supervising them, making sure things are done right.
Important point. Quality over quantity. Always.
Absolutely. And the more experience that supervisor has, the better. If you've got lots of new nursing assistants, you need a really experienced RN to guide them.
Delegating is great, but not if it compromises patient safety.
Totally agree. What about the physical space? Does that matter for staffing?
I wouldn't have thought so, but I'm guessing you're going to tell me it does.
You bet. Where the equipment is, how the unit's laid out,
Yeah.
it all impacts how efficiently people can work. If nurses are running all over the place, that's less time with patients.
You got to make things flow smoothly.
Yep. Even little things like where are the supplies, the meds, it all adds up.
So many details to consider.
It's all connected. And then there's how quickly patients come and go.
Patient turnover, right? Like if people are constantly being admitted and discharged.
Exactly. Busy units like the ER or post-surgical units need more nurses because there's always something happening.
Makes sense. Got to stay on top of all those moving parts.
And of course, how experienced are your nurses? More experience, they can handle more, so that affects how many you need overall.
Not just warm bodies. Got to have the right skills.
Right. Need that mix of senior nurses to lead the way and new nurses to bring fresh energy.
Finding that perfect balance. What about other healthcare folks? Do they impact how many nurses are needed?
They do. Therapists, social workers, pharmacists, dietitians. If they're doing their part, that takes some pressure off the nurses.
A true team effort, everyone using their expertise.
Exactly. Shows why it's so important that everyone talks to each other, works together.
We've talked about equipment, staff. What about the actual building itself? Does that matter?
You bet. How the unit's designed, where things are, can make a big difference. If it's really spread out, nurses are spending more time walking, less time with patients.
So, got to make it easy to get around, do their jobs.
Exactly. It all adds up.
Wow, I'm exhausted just thinking about all these factors.
It's a lot, but it shows you there's a lot of thought that goes into this. It's about giving good care and using resources wisely.
Right. No easy answers. Got to keep adjusting, figuring out what works.
And that's one of the things that makes healthcare so challenging, but also so fascinating.
So true. We've covered a ton today. From those patient classification systems to all these different nursing care models.
It's been quite a journey.
It has. Before we wrap up, got to thank our partners at London Heartbeat Z Academy again. They've been incredible.
Couldn't have done it without them. If you're interested in healthcare, you need to check them out. Over 140 courses, all sorts of topics.
Super easy to access, too. They're on all the socials, Facebook, Instagram, Spotify, YouTube.
Give them a follow. You won't regret it. Okay, back to our deep dive.
Right. So we've seen all these different approaches to nursing care.
Yeah.
Each one trying to solve the puzzle, high quality, efficient, putting the patient first.
It's a tough puzzle.
It is. And before we go, got to mention, the best model, it really depends. The hospital, the patients, the resources you have, all that plays a role.
Absolutely. What works in a big city hospital might not work in a small town.
Good point. Brings up a question we haven't really talked about. What about places that aren't hospitals?
Ooh, yeah. Nursing homes, rehab centers, clinics, home health.
Huh?
How do they decide on a care model?
We barely scratched the surface here.
Right. Think about the challenges of home health. Nurses running all over town, working on their own. Do they adapt these models, or do they need something totally different?
So many
And
possibilities.
imagine team nursing for home health. Not physically together, but still coordinating, working as a team. Could that work?
Interesting. Would take a lot of communication trust.
Totally. Or how about case management in a rural nursing home where there aren't many specialists around?
Oh, that'd be tough. Case manager would have to be super creative, resourceful,
Right, they're like a lifeline, connecting patients to whatever resources are available.
and they'd have to fight for their patients in a system that's not always easy to navigate.
Makes you realize you got to be flexible in healthcare. It's about problem solving, finding what works, even when things aren't ideal.
This deep dive has really made me think. Nursing care delivery, it's a whole world unto itself.
It is so complex and constantly changing. New challenges, new technology, always got to adapt.
Makes you appreciate all that goes on behind the scenes to get patients the care they need.
Right. It's a reminder that we're always learning, always trying to improve.
So to our listeners, keep asking those questions, keep learning, don't be afraid to speak up, make sure you're getting the best care possible.
And if you're looking for more info, London Heartbeat C Academy is a great place to start.
Yes, their courses, their social media, it's all fantastic. Thanks again to them for their help.
Huge thanks, and thank you for listening.
Until next time, stay curious.
It's amazing, right? All these different ways to deliver care, and each one has its own challenges depending on where you are.
Absolutely. Like a busy city hospital is a totally different beast than a small rural clinic or someone's home.
Right. And then you've got those factors we talked about, staffing shortages, limited resources, specialized equipment. How do you make these models work when you're dealing with all that?
So many questions. Like, could team nursing work in home health, where the nurses aren't actually together but still need to coordinate?
It'd be interesting to try. They'd need to be pros at communication, really trust each other.
And what about case management in a rural area? Maybe a nursing home where there aren't many specialists or access to fancy equipment.
Oh, that'd be tough. The
It's
case manager would be even more important there, connecting people with whatever resources are available.
right. And being a strong advocate, helping patients navigate a system that can feel really overwhelming, especially if you're not in a big city.
Healthcare takes a lot of creativity sometimes, finding ways to make it work, even when the odds are stacked against you.
This whole deep dive has been eye-opening. Nursing care delivery, it's a whole world unto itself.
So complex. And it's always evolving, As the needs change, the technology changes, gotta stay adaptable.
Makes you really appreciate the nurses and everyone who works behind the scenes to make it all happen.
Absolutely. And for our listeners, if you're interested in learning more, don't forget about London Heartbeat Z Academy. They've been so helpful with this episode.
Yes, huge thanks to them. Over 140 courses on all sorts of healthcare topics.
Check out their website, their social media. It's a treasure trove of info.
Absolutely. So to wrap things up, what are the big takeaways from our deep dive into nursing care delivery models?
Well, first, it's more complicated than most people realize. There's a lot of thought that goes into deciding how to deliver care, and it's not one size fits all.
Definitely. We've seen all these different models, each with its own pros and cons. The case method, functional nursing, team nursing, modular nursing, progressive patient care, case management. It's a lot to keep track of.
Right. And the best model really depends on the situation. What kind of facility is it? What are the patient's needs? What resources are available? So many factors.
Exactly. And it's not just about efficiency. It's about making sure patients feel cared for, that they're part of the process.
Absolutely. That human connection is so important.
So to our listeners, no matter where you're getting your health care, don't be afraid to ask questions. Find out how the nursing care is organized, what to expect.
Knowledge is power. The more you understand, the better you can advocate for yourself. Make sure you're getting what you need.
Couldn't have said it better myself. And remember, we're all learning all the time. Healthcare is constantly changing. There's always something new to discover.
Exactly. Stay curious, stay informed, and keep those brains working.
Well said. That's it for this deep dive into nursing care delivery models. Thanks for joining us.
And thanks again to London Heartbeat Z Academy for their support.
Until next time, stay curious.